So what are we going to get to talk about for the next half hour? Well, it's interesting that we carry on arguments about fine points in science, and the great big world couldn't give a crap. It goes on, right? People are born, they live, and they die. The passing out of healthcare is both a scientific and a sociologic product. Why do you think chiropractors still exist? Right? They're covered by the insurance in most states. I have no idea why you'd pay people money to rub your neck. I have no idea why you'd pay them to rub your back. I understand paying them to rub your front, okay? Been there, done that. But the bottom line is, it is a sociologic product which is not pure science. If you're looking for pure science, be a physicist or something. You know, I have a friend who's a physicist, and he makes particles that last for like a nanosecond. And I said to him one time, I said, well, that's a very tough product, because how do you package it and sell it? And he just shook his head and walked away. And I mean, he just says, you guys don't do real science. And I said, you can't do science like you do it on humans, because they have this huge right brain which decides one thing. Does Mikey like it? Yes or no? Why do you think you write prescriptions that you know people don't need? Anybody here ever written a prescription that they knew they didn't need? If you don't put your hand up, you're just a liar, okay? You're an idiot or a liar. It's like, do they really need an x-ray of their ankle? They don't meet the Ottawa ankle criteria. Do they need it? No, but do they get it in most places? Yes. Why? Because people believe that the x-ray itself is therapeutic. It'll help the swelling go down or something. I don't know. But understand, it's the giving out of the product. Some historical references. I am basically an economist. I'm a member of the Midwest Economics Group. I give talks there. We argue about Hayek and von Mises and all that sort of thing. And this is, you got to remember, U.S. healthcare is the largest economic product in the world. And let me tell you about its growth. 1946, the Second World War has just ended. As they looked at the economy, and by the way, moving that economy back to a regular economy was the mark of brilliance. It was incredibly difficult. We had taken over for government production virtually everything in the United States. And now you got to return it. One thing happened during the war was you could not pay wages above a certain level. You couldn't do a bunch of things. So companies had to get workers. Most of them came out of the South, as a matter of fact. The reason that urban centers in the North developed and certainly have black populations is because during the war, they hauled people in the boxcar loads up to Philadelphia, Detroit, Cleveland, those places, and they gave them housing, and they gave them health care. Kaiser was the first major corporation. Of course, during the war, Kaiser built what? Liberty ships. They got it down where they were producing one a day. You know, what beat the Japanese and the Germans wasn't necessarily our bravery. We had more shit to throw at them. We could throw crap till hell wouldn't have it because we could produce. There's no question about it. But how do you keep people working 12 hours a day, 6 and 7 days a week? You give them stuff. The submarine sandwich came from the sub shop, or the sandwich shop, next to the Groton, Connecticut submarine base. And they said, what are those? Because they made their sandwiches on long buns. Say, that looks like our submarines. So the government went to them. They had 2,000 people there building submarines. And they said, here's a whole bunch of money every day. We want those things that look like our submarines. We want 2,000 of them delivered here every day. So the guy started calling them sub sandwiches. I mean, that's kind of how things go. Well, insurance went the same way. They couldn't give them more money, but Kaiser said, we'll build health care. 5% of Americans had health insurance before the Second World War. 5%. And that only covered about half of their bills at that moment in time. And the bills were pretty reasonable because doctors had to say things like, can you afford this? You realize our residents today have never seen a bill. They don't even know what stuff costs. If I actually go up to them and say, what does Januvia cost? They got no idea. Yeah, but you refilled somebody's prescription for it. Was that a smart thing or a dumb thing? They have no idea. Well, what's my message today? The affordable, that might be unaffordable, Care Act. We've now passed a bill that's supposed to bring in more people. Is that good or bad? Well, it depends on how you look at it. All economic engines have a governor on them that controls their motion and speed. It's very clear in England what the governor is on health care. It's what? In England, it's here's the amount of money we've put up for health care. Here's a lump. And by the way, you're in a health region. England passes out by health regions. Said, you guys, here's Manchester. Here's a lump of money. Do with it as best you can. But the governor there is they control what's given and how much. You know, in this country, what's been the governor? There hasn't been one. The problem is for 50 years, doctors told, and the AMA is guilty in this. They're guilty as charged. And I've been on committees of the AMA, and quite frankly, I wouldn't join again. Because they didn't help to shepherd the process in discovery here of what we needed and what we didn't need. The amount of useless crap in this country is unbelievable. And if you want useless crap and it's your money, I don't care what you buy. I'm a libertarian. If you want to own, 25 sports cars and you bought it with your money and you don't ask me, God love you. But don't ask me to contribute to it. That's the current problem, is that we got used to spending money. And let me give you some numbers, basically, of the countries that I work in or consulted in. The Singaporeans, and I was the U.S. advisor to Singapore when they converted over their emergency medicine system. They spend, and again, in 1946, we were spending 3.8% of the gross national product on healthcare. 3.8%. As of today, the Singaporeans spend 4.5%. Next year, you will hit 20%. The Singaporeans live longer than you do. Their male longevity, their female longevity, and their infant mortality is less. What? Well, there are a few infants. They have so much money they can rent them, okay? Which, as far as kids go, is the best thing you can do. But the point is this. There are people who are producing stuff that's pretty damn good for a whole lot less money. But they've made the Canadians are half us, half what we spend. If you walk over the border, do you see a lot of dead Canadians laying around? No, except at the end of hockey games, okay? But basically, the Canadians are very, very nice, and they do pretty well, actually, with 10%, half what we spend. If we were spending the same amount as the Canadians, you'd have a budget surplus. I'll give you one other number you don't like, and when you're when you're with economists, and I'll be the only doc at the table, they say, well, it's very interesting, as we look at this expenditure, and we have all the numbers and all that kind of stuff. And if you haven't read Rick Bucata's piece that goes with emergency medicine abstracts, on the study that looked at the 46 sort of healthcare regions, 246 healthcare regions in the United States. You should read it, reflect on it, and understand you're going to get sucked into the vortex of this study. 5 of the best areas in the United States, were they in Boston? Where are Boston people? Yeah, no, they're not. Cost-benefit analysis. Remember in the movie Field of Dreams, when the guy says, "Is this heaven?" And he says, "No, this is Iowa." Iowa's pretty damn good. They live longer than Florida. They live longer than New York State for a third the money. Best state, United States, South Dakota. Live a long time, spend nothing. You spend almost 4 times as much money per elderly person in the state of Florida as you do in the South Dakota, and they don't live longer. They don't live longer. Why? Because there's no big-time healthcare center in South Dakota. There's nobody who thinks he's king shit. And nobody who thinks that, you know why they put locks on caskets? Yeah, that's so as they're lowering it down, the chemotherapist can't give another dose of chemotherapy. In any event, so the Affordable Care Act passed March 23rd, 2010. It's the biggest change in my life. I remember I was studying economics in high school at the time that the Medicare program was passed, 1964. And all the numbers were put out. And then I'll ask anybody here as a question. Taking into account inflation, as if we used, they use a phrase in economics called hamburger economics. They use the price of the McDonald's hamburger because it's the same weight, the same crap on it, the same wrapper as it was in 1960 when they started. The only thing, what? No, it's close enough that they can use that. And then the question comes up, how much has it gone up? Well, we know what that was. It was 15 cents, and now it's like $1, about $1. So that's the difference of how if we keep product to product. Healthcare, oh my God. How wrong were they about the costs to the elderly? Eliminating inflation, they were 11 times, 1,100% wrong. Why? Because there was no prosthetic hip in 1964 like this. There wasn't a liver transplant. There wasn't a heart transplant. There wasn't any of this stuff. So when you're adding things to the menu, you got to do what? Be honest enough and withdraw the money. Did they? No government ever does. Believe me, the Czechs, and I was just there, and the Hungarians, and I was just there, are in the exact same state. They don't know what they're going to do, so they're now cutting stuff back. Very painful. Remember the Swedes, the happy Swedes? Lumska, dumska, ja, sure, you betcha. Yeah, womb to tomb security, right? Yeah, no, that's all gone now. They're rethinking it because it didn't work out in the long run. So Affordable Care Act comes along, and the summary is 906 pages. You realize that only 2 people who voted at the time that it was passed actually said they'd read it. 2 of the House of Representatives. And we have 435 of those guys. They said, well, you can't expect me to read all that. Shit, what did I send you there for, asswipe? Bang! Over the head. Were there things that were popular? Absolutely. With both sides of the aisle, everybody. What was the most popular thing? Name it. No, pre-existing condition had some, that was back and forth. What was it, Billy? Kids to 26. Why? Because Republicans are just like Democrats. They got a bunch of useless kids sitting around the house that they don't know what to do with. They all got degrees in primal scream masturbation and can't do anything. I got 3 kids, they're useless. Okay? Everybody needs to understand that. There was a reason that that one was going to pass, and it had to do with who was laying around the house in both Democratic and Republican setups. That's exactly what happened. The whole gap for drugs, semi-popular. Preventative care, which has a big section in there, is probably useless. You realize there's very few things we can prevent that are not lifestyle things. Is smoking a good thing? No. Okay, we'll agree on that. Should you drink and ride your motorcycle? Yes or no? No, probably not a good thing. There's a bunch of stuff that we could agree on, but it's been oversold to the American public. Let's ask this question. If you see a kid at age 8 and he has no complaints, does he need a yearly physical exam? Absolutely not. There's no proof that that's of any value at all. There are things which are of high value, but they don't need a doctor, right? Immunizing your kids. All you need somebody who can draw the shit up out of a bottle and make sure it's the right amount and stick it in them. The yearly pap smear. Proof? No proof. Depends on who you are. If you had a family history of 10 people who had the disease, and we actually can now run and find out where your genetic predisposition is, you may be one of those that is. There may be people who don't need it for 10 years. So we need to ask some questions, and a lot of the preventative stuff is just flat ass out wrong. Here's the real problem. This is where the philosophic divide takes place in a questionably free society. Can they mandate that you buy insurance? Well, you see, that had nothing to do, that only had something semi to do with the money. Only semi. That had to do with what do free people have to do. And if you're a good libertarian, do you give a crap whether your neighbor buys health insurance or not, as long as you don't have to pay for them? That's the issue. That was a moral, philosophic issue, and it's tough. Now, what they said is, let's make this more palatable. So if you're covered under some insurance plan which we approve, you don't have to buy anything else. That's good. For example, I'll be 67 this year. I'm on Medicare. By the way, with all the crap that I have to buy along with it, it costs me just as much money out of my pocket as when I was paying for my insurance plan. Why? Because I'm a rich guy. Okay, shit happens. Citizens of certain states that have decided to opt out, stay in touch with this one, because something happened this week that you want to know about. South Carolina, the place where actually the first shot of the Revolutionary War, it was a naval battle, off Charleston, took place. It was the site of the first shot of the Civil War. Fort Sumter is right there. They announced this week they are opting out of all federal health programs. This is the new, we don't give a crap what you want deal. And it is going to be interesting. South Dakota, which has nothing to do with South Carolina, in case you've not been to the two places, said the exact same thing. What they said is, in fact, North Dakota's got so much money. It's got more money than God. Strippers make $2,000 a night. And it's, and I'm sure they pay cash on all that money, right? Take tax on all that, yeah. Bottom line is, they said, we don't want it either. So stay tuned to this. There is going to be a series of questions about opt-outs, which we don't, in that huge bill where the summary is 906 pages, where we have to figure out we've got a loophole that we don't know what to do with. And what is really going to happen is you're going to have states that are tax producers deal with states that are tax eaters. And they don't know what to do. Remember, South Dakota, 3.5 times, or Florida is 3.5 times per Medicare recipient as South Dakota. And these things are going to be fought out. The health insurance exchanges, yeah, Billy.
But some other states caved that said they weren't going to play. So Florida caved, Virginia caved, and because of the tax structure, the states that opt out, they're still going to be paying the taxes in that are going to be eaten by the others. Even if they don't play, they don't get out of the taxes.
Hold on a second.
So the device taxes, if you implant a device in North Dakota or South Dakota, they're still paying the device tax. It's just going to the other states.
Right. Well, just understand that this isn't clear yet, exactly how it's going to be paid out. The health insurance exchanges is the opt, which some of them may do. Let's say, for example, there may be a system worked out where South Dakota, by the way, does not have a center to do big-time cardiac stuff. They do some small stuff, not big stuff. They don't do peds neurosurgery. They will get in exchanges with other states, paid for in other ways, and there may be some help from the federal government on this. But the last thing the feds want is people reinventing more what? Stuff and more locations and people who have to do tests to justify the payment of what they've got. They all knew this was going to happen, so they can't do it. There are 33 metrics which they've decided to look at. And here's another problem which this course emphasizes all the time. If you can't measure what's important, what you can measure becomes important. Because we can look at it doesn't mean it affected the healthcare outcome. So what the hell are these 33 metrics? We don't know exactly. We know some of them were just, like the pneumonia ones. You had to have a set of blood cultures, right? Is there any proof that that does anything? None, zero. The point is that was one of the metrics. So let's look at a couple of other things here that are going to be important, and that is where the money comes from. Here's the biggest problem with the quote-unquote healthcare debate. It had nothing to do with health and nothing to do with care. It only had to do with one thing, the money. But it didn't have to do with health. For example, they needed to have a real debate, and the AMA knew this, and they were cowards. They chickened out. They needed to have a debate about what do you do with grade 4 astrocytomas. We know what the Brits do. We give you steroids, kiss you on the forehead, and say, have a nice life. Here we debulk the tumor, we run $200,000 worth of bill, and 6 weeks later you're dead. And you have a miserable life. Why? Because you sit there from the chemotherapy and radiation and vomit. You heard about the guy who went to his doctor. The doctor says, well, you got 6 months to live. I said, what should I do? And he says, marry an ugly woman and move to Cleveland. He said, I'm going to live longer. No, but it'll seem long. Okay? and that's... okay. Now, if you look at where the fights will be, the mandate thing is not dead yet completely, and no matter how you cut it, you're going broke. You're spending huge amounts of money. I'll give you a number, because I was involved in this fight. Looking at the expensive emergency department care, the federal government pays more money for cardiology consults and EKGs than it does for all emergency care. Is that wrong somehow? They spend almost 21% of their money on drugs. In 1946, that was 3%. Do you honestly believe that all the drugs we give out are essential to what we want to accomplish as a healthcare system? But they didn't ask any of those questions, and it's going to come along. Now, what I'd rather, I've got 2 minutes, and then I got to tell you a story before Billy starts. But there are going to be areas, I've lived my life by asking forgiveness, not permission. We've got to be led by the bold. We need to go to the federal government and say, we'll organize this. Let's come up with things that are going to happen. It's going to be more outpatient than inpatient. Can we all agree with that? Does anybody think they're going to be building a lot more hospital beds? Yeah. Number 2, They need somebody who says in or out. Expensive care, cheap care, that's us. Number 3, you're going to have more centers that look at people for like 12 hours or 24 hours. They don't get a bed upstairs. Who's going to do that in this country? Family practice? Pediatrics? No, it's going to be us, so we need to go forward and put out the proposal and say, we'll do it for this much money. And we can show them where we're going to cut it down. But where we're going to have to function seriously, and I promise you that, is we're going to have to take the bull by the horns about cutting down the amount that's spent on all this crap. We are not raising residents, no offense to anyone in the room, but we're not raising cost-effective people who ask, what am I getting for this test, this x-ray, this drug, this therapy, and how come we didn't let grandma die at home? That's where it's going to go if you're not going to, and this boat is not going away. Let me tell you the most dangerous number out there is, you see this? I am your problem. I'm on Medicare now. And if in the next 4 years, and here's the bitch that nobody wants to talk about, the Affordable Care Act isn't fully implemented till the year 16, maybe 19, certain other things that are out. In that period of time, there are 12,000 people a day going on Medicare. There are only 7,000 people a day re-entering the workforce. This gap is expanding, not closing. So these questions will not go away. Liability, eventually we're going to have to overcome the stranglehold which plaintiffs' attorneys have on the Democratic Party. Largest single contributor to the Democrats, plaintiffs' attorneys of the United States. I'm sorry, we can't run liability the way we're doing it now. You need to have a panel. Is somebody here from New Zealand? Yeah, we need a New Zealand panel that just says, here, this is what you get, thanks. And by the way, doctors there who say, you know, that doc is dangerous, we're going to pull his license. But to have a battle of experts, I was on the phone all day yesterday afternoon. I sent him a huge bill. I shouldn't be doing that. I'm counseling attorneys on a case where the science is clear. It should not happen. And you know what? We're going to have to get rid of it. The holding unit kind of stuff I talked about. And I would only reference that 17 years ago, when I became president of the college, I gave a talk on something called the central hub theory of care. Everything came true. We're training people and we're functioning as if we have a 1950s model of health care. It's wrong, and it will fall apart, and you need to watch what's going to go on, because somebody's going to have to say the word, and you see, in Washington, you can say the F word. They let Billy in there. It's okay. You can't say the R word. We are going to control or ration certain kinds of care, tests, things like that. And here's the joke. The healthcare outcomes will be better. Why are we in this mess? We all sort of look around and say, you know, you're like the piano players in the whorehouse of medicine. You're just plunking the keys and never ask what goes on upstairs. Oh, it's not my fault. It's not my problem. You know what? You better as a group start asking those questions at the hospital level, the local level, and get into it. Because I'll tell you what, if you think that the Affordable Care Act by 19 is going to be fully implemented without some of this stuff, you're smoking dope. But it's okay, you're here in California, and Billy will write you something. Now, Billy's about to give you the talk on ATLS. I'm only going to tell you one little story. I had to go into the lion's den. When the surgeons finally decided in 1996 that they would meet with us on trauma. So where did we meet? You're all set? Yeah. Where did we meet? We met at the College of Surgeons in Chicago, where you go down the hallway and they have all their dead presidents on the wall. It's very, very impressive. Yeah, there's a seat right here. All the dead presidents on the wall. So we're sitting there, and I gave a talk, and you're looking at members of the trauma team, who are basically academics, who haven't seen a case in years because their residents do it. And they're saying, well, you don't call the surgeons early enough, and you people clearly aren't qualified to examine such patients. I said, you don't know what's happening in the world. I said, we see everybody. We're begging people to come in to get certain specialties in. They ain't coming. They couldn't understand that. The chairman of their trauma committee considered himself quite an educated man. Now, I know you don't want to hear surgeon and educated man in the same sentence. It frightens you. But he wasn't an orthopod, so it's a possibility. And I finished my talk, and he said, well, methinks the lady, as it says in Macbeth, methinks the lady does protest too much. Well, he made a mistake, because I had written a paper on that line. And I said, I'm sorry, the line, methinks the lady doth protest too much, is Act 3, Scene 2, line 252 of Hamlet. I hope your science is better than your Shakespeare. And they're all going like that. I said, now we can start. You know, there are small victories around there which we have gotten. Stay tuned. Emergency medicine is going to play a much bigger role than you can ever imagine.